Think prevention, live long.
Again, I'm Dr. Shah. We're going to be reviewing your office visit today. So I'll be back in the room once you watch this video. But let's go over through some of the questions I'll be asking you. So, obviously I'll confirm your first name, last name, because, at times you have patients with a similar last name and first name. We want to make sure that we have your date of birth and your primary care number. And also if you have a common last name and first name, make sure you tell us that we find your MySys number, which is the number we gave you in our computerized chart here. So again, it's critical we put all the proper demographic information about you. Primary care is very important, so we send the letter to the right doctor. The next question will be, what is your main concern today? And I want to always stay focused on the main concern you have, so at least we resolve that and then also continue with other prevention also. So when you are watching this video, you'll have this paper in hand, which you'll be taking essentially notes and also writing down questions for me as you watch the video. The common question I would ask you is if you have any chest pain or not. The heart chest pain or the cardiac chest pain typically would be the chest pain which would come on exertion or go away with the rest. Many times you will feel pressure, heaviness, tightness, any chest sensation or feeling which comes on exertion and goes away with the rest is heart related until proven otherwise. So we want to make sure that if you have any sensation in the chest which comes on exertion, I know about it. Shortness of breath, again, I want to make sure that if you're getting progressively more and more shortness of breath as you do activities, if you're getting fatigue over the time, dizziness, if you're feeling lightheaded or dizzy, that could be a sign of low blood pressure, sometimes low heart rate. If you had a blackout, I need to know about it. If you're having any fluttering sensation in the chest or racing of the heartbeats, that could be a sign of heart disease also. If you're getting any pain in the calf or leg or thighs or buttocks when you walk and goes away with the rest, that could be a sign of PAD, peripheral arterial disease, where you're getting plaque buildup in the leg arteries. If you're having any significant muscle aches, particularly all over the body, I need to know about it. Certain medication can cause muscle ache. If you have a chronic cough, I need to know about it, because cough could be a sign of sometimes heart failure. Sometimes certain medications can cause cough. I also need to know about ED, erectile dysfunction, in obviously a male patient, because ED could be a sign of vascular disease. People who have ED, they have higher chance of heart attack and stroke. So I need to know about it. Plus, if you need a treatment, we can easily discuss about treatment options too. Smoking, I need to know about it. How much alcohol you drink, how much caffeine you take, and also obviously how much exercise you do, and you have any kind of a specific diet plan or not. Once this video you watched, I'll come back in the room and we'll go over through your medications. So if you can have all your medications ready on the table and have your medication list ready. If you don't have medications with you, or if you don't have the list, at least have your pharmacy number, phone number and name ready, so we can call and get the updated list. It would be nice if you bring every time medication list or the medications themselves. Once I come in the room, we'll go over through the physical exam to make sure you don't have any blockage in the neck. So I'll listen to your neck artery. I'll listen to your heart to make sure there is no any new heart murmur, or if you have a heart murmur, it's getting worse or not. Listen to your lungs to see if you have any signs of congestive heart failure or any kind of wheezing or other lung disease. Look at your legs to make sure there is no leg swelling. Check pulses in the legs to make sure there is no peripheral arterial disease. We will review the labs you already had. So if you have had a labs checked since I saw you last time, make sure you let us know. It should be in our system, but if not, we can call the lab and get labs for you so we can discuss it. Many times you already will have a heart testing done either in my office or outside my office. We'll make sure we have a copy of those testings. Sometimes it will take an extra time if those labs or the results from other testing are not in the office and your visit may get a little bit delayed, but we always will have option of rescheduling you and going going over the results over the phone if you feel that's the way you want. Typical visit should not take too much of a long time, but as patients are sometimes complex, I don't look at the watch and I don't wear a watch, so I just come in the room and take my time, and I make sure that you get your time. So again, I'll try my best to be in a timely fashion, which I know is very important for you, but I think the more important for both of us is to provide the complete heart-related care and prevention. And sometimes you come and see me every 6 months, every year, so let's just spend as much time as you need so you get the best care while you made an effort to come all the way and park your car and wait for me. Stop me if you have any questions while we talk. Good chance that we'll be able to keep you out of the hospital for many, many years, and that requires a lot of good communication, good team efforts, and we'll do it together. So thank you.
When we think prevention, live long, the heart of mid-Michigan strong.